Have you ever climbed a flight of stairs and found yourself unusually short of breath? Or maybe you've noticed a strange pressure across your chest while carrying groceries, only for it to disappear after a few minutes. Perhaps you've brushed it off, telling yourself, "I'm just getting older." But what if your heart is trying to tell you something important? Many older adults don't ignore heart problems because they don't care about their health. They ignore them because the earliest warning signs often don't look dramatic. They can seem so ordinary that they're easily mistaken for normal aging, stress, poor sleep, or simply having a busy day. That's what makes them so easy to miss and sometimes so dangerous. Today's video is about those early signs. We'll look at symptoms that deserve attention, explain why they happen in simple language, and discuss when it's a good idea to talk with a healthcare professional. We'll also cover one common symptom that surprises many people because it doesn't even involve the chest. So stay with us until the end. You may recognize something that could help you or someone you love. Our hearts work around the clock, every minute of every day. This remarkable muscle pumps blood throughout the body, delivering oxygen and nutrients to every organ. Over the years, the heart naturally changes with age. Blood vessels may become a little stiffer, and the heart doesn't always respond to physical activity as quickly as it did decades ago. Some changes are expected, but certain symptoms are not simply getting older. They may be signs that the heart is under strain or not getting enough oxygen-rich blood. The challenge is that heart problems often begin quietly. Instead of sudden, severe pain, the first clues may be subtle and easy to dismiss. That's why learning to recognize them can make a real difference. Let's start with one of the most overlooked warning signs: shortness of breath. Many people assume they're becoming less fit as they age. Maybe they've stopped exercising as much, gained a little weight, or simply don't have the energy they once had. So when walking uphill or climbing stairs becomes more difficult, they often blame aging. But if you're becoming breathless during activities that used to feel easy, or if you find yourself needing to stop and catch your breath more often, it deserves attention. Why does this happen? Your heart and lungs work as a team. When the heart isn't pumping efficiently, your muscles and organs may not receive enough oxygen-rich blood during activity. As a result, your body tries to compensate by making you breathe faster and harder. Imagine trying to water a garden with a hose that has low water pressure. You can still water the plants, but it takes more effort and the results aren't the same. A heart that's struggling to pump effectively creates a similar situation throughout the body. This doesn't automatically mean someone has heart disease. Shortness of breath can also be caused by lung conditions, anemia, which means having too few healthy red blood cells, or even certain medications. But because heart problems are one possible cause, it's important not to ignore persistent or worsening breathlessness. Here's a simple question to ask yourself. Can you do the same daily activities you could comfortably do 6 months ago? If the answer is no and there's no obvious explanation, it's worth discussing with your healthcare provider. And here's something many people don't realize. Sometimes the next warning sign appears even before noticeable chest discomfort. In fact, it's one of the biggest reasons older adults delay getting help. That sign is unusual fatigue. We're all tired from time to time. A poor night's sleep, a busy week, or emotional stress can leave anyone feeling worn out. But heart-related fatigue is different. People often describe it as feeling unusually drained after very little activity. Tasks that once seemed effortless, making the bed, walking to the mailbox, preparing breakfast, or shopping for groceries, suddenly require frequent rests. Instead of saying, "I feel sleepy," many people say, "I just don't have any energy anymore." This happens because when the heart can't pump blood as efficiently, muscles receive less oxygen and fewer nutrients. Everyday activities begin to feel harder because the body is working with a smaller energy supply. Think of it like trying to power your home during a brownout. The lights still work, but everything feels slower and weaker. Your body responds in a similar way when the heart isn't delivering enough blood where it needs to go. Older adults often assume this kind of fatigue is simply part of aging. While it's true that energy levels may change over time, a sudden or noticeable decline should never be dismissed without considering possible medical causes. If persistent fatigue is accompanied by breathlessness, dizziness, swelling in the legs, or chest discomfort, it becomes even more important to seek medical evaluation promptly. Now here's another point that surprises many people. The next warning sign doesn't always feel painful. Sometimes it feels more like pressure, tightness, heaviness, or fullness. And because it isn't the dramatic chest pain people see in movies, many people ignore it. We'll talk about that next, along with why some heart problems can cause discomfort in the jaw, shoulders, back, or even the stomach instead of the chest. Pressure, tightness, or discomfort in the chest is one of the best-known warning signs of heart trouble. But there's an important detail that many people don't know. Heart-related chest discomfort doesn't always feel like a sharp pain. Some people describe it as if someone is sitting on their chest. Others say it feels like a squeezing sensation, a heavy weight, burning, fullness, or an uncomfortable pressure that comes and goes. In some cases, it lasts only a few minutes before fading away. Because the feeling isn't always severe, it's easy to explain it away. It must be heartburn. I probably lifted something too heavy. I just slept in an awkward position. Sometimes those explanations are correct. Indigestion, muscle strain, and acid reflux can all cause chest discomfort. But because the heart is such an important organ, it's never wise to assume chest symptoms are harmless, especially if they're new, happen during physical activity, or keep coming back. One clue that healthcare professionals often consider is timing. Does the discomfort appear when you're walking, climbing stairs, or carrying something heavy? Does it improve when you stop and rest? That pattern can suggest that the heart is working harder during activity but may not be getting enough oxygen-rich blood. It doesn't confirm a diagnosis, but it does mean the symptom deserves medical attention. Imagine driving a car uphill with a fuel line that's partially blocked on flat roads. The engine may seem fine, but when more power is needed, the problem becomes noticeable. Your heart can behave in a similar way when its blood supply is reduced. And here's something even more surprising. Not everyone feels discomfort in the center of the chest. Sometimes the first warning sign appears somewhere else entirely. Pain or discomfort may spread to the left arm, both arms, the shoulders, the neck, the jaw, the upper back, or even the upper stomach. Women, in particular, are more likely than men to experience less typical symptoms, although anyone can have them. Imagine waking up with an aching jaw that seems to have no dental cause or feeling. Discomfort between your shoulder blades after a short walk. Because these symptoms don't match the classic image of a heart problem, many people wait days or even weeks before mentioning them to a healthcare professional. That's one reason awareness matters so much. The body doesn't always read from the same script. Sometimes heart-related symptoms are loud and obvious. Other times they're quiet and unexpected. The goal isn't to become anxious about every ache or pain. It's to notice patterns that are new, unusual, or occurring together. And that brings us to another symptom that's often mistaken for normal aging: feeling dizzy, lightheaded, or as though you might faint. Most of us have stood up too quickly and felt a brief moment of dizziness that can happen when blood pressure temporarily drops and usually passes within seconds. But if dizziness becomes frequent, happens during activity, or is accompanied by chest discomfort, shortness of breath, or a racing heartbeat, it should not be ignored. Your brain depends on a steady supply of oxygen-rich blood. If the heart isn't pumping effectively or if the heart rhythm becomes abnormal, the brain may briefly receive less blood than it needs. The result can be lightheadedness, unsteadiness, or even fainting. Of course, dizziness has many possible causes: dehydration, inner ear disorders, medication side effects, low blood sugar, and low blood pressure are just a few examples. That's why it's important not to jump to conclusions. But it's equally important not to dismiss recurring dizziness as just getting older. A healthcare professional can evaluate the full picture and determine whether the heart or something else is responsible. Here's another question worth asking yourself. Have you stopped doing certain activities because they suddenly make you feel weak or unsteady? Sometimes people gradually change their routines without realizing it. They stop taking evening walks. They avoid stairs. They ask someone else to carry heavy bags. They park closer to the entrance. At first, these changes seem practical, but over time they can become clues that something has changed physically. Listening to your body doesn't mean becoming fearful. It means recognizing when your normal has changed. Now let's talk about a sign that many people notice only after looking back: a faster, slower, or irregular heartbeat. Most of the time, we aren't aware of our heartbeat. It quietly does its job without attracting attention. But sometimes people suddenly become very aware of it. They may notice fluttering in the chest, a pounding sensation while sitting quietly, a heartbeat that seems to skip, race, or beaten evenly. These sensations are called palpitations, which simply means you're aware of your heartbeat. Many palpitations are harmless. They can be triggered by caffeine, stress, poor sleep, dehydration, or certain medications. However, persistent or recurring palpitations, especially when accompanied by dizziness, fainting, chest discomfort, or shortness of breath, should be evaluated. One possible cause is an abnormal heart rhythm, also called an arrhythmia. In simple terms, this means the heart's electrical system isn't keeping a normal rhythm. Some arrhythmias are relatively harmless. Others can increase the risk of complications such as stroke or heart failure if left untreated. The encouraging news is that many rhythm problems can be diagnosed with simple tests and managed effectively once they're identified. That's why paying attention to changes matters. Sometimes the earliest warning sign isn't pain. It's simply that your heart no longer feels like it used to. Coming up next, we'll discuss 2 warning signs that many older adults never connect with heart health at all: swelling in the feet or ankles and waking up at night struggling to breathe. Both can be subtle, but together they may reveal that the heart is working much harder than it should. Knowing the warning signs is only part of the picture. The next step is understanding what to do if you notice them. One of the biggest mistakes people make is waiting for symptoms to become severe before seeking help. They tell themselves, "I'll see how I feel tomorrow." Then tomorrow becomes next week. Next week becomes next month. By that point, a condition that might have been identified and managed earlier may have had more time to progress. That doesn't mean every unusual symptom is an emergency. Far from it. Many symptoms we've discussed today have causes that are not related to the heart. Fatigue can come from poor sleep or anemia. Swollen ankles may be caused by vein problems or certain medications. Shortness of breath can result from asthma, lung disease, or being out of shape. The important point is this: if symptoms are new, persistent, getting worse, or occurring together, they deserve medical attention rather than assumptions. Your healthcare provider may recommend a physical examination, blood tests, an electrocardiogram, often called an ECG or EKG, which records the heart's electrical activity, or other tests depending on your symptoms and medical history. These evaluations help determine whether the heart is the cause or whether something else needs treatment. It's always better to investigate than to guess. There is one situation, however, where waiting is not the right choice. If you or someone around you develops chest pain or pressure that lasts several minutes, severe shortness of breath, fainting, sudden weakness on one side of the body, trouble speaking, or pain spreading to the arm, jaw, neck, or back along with other concerning symptoms, seek emergency medical care immediately. Time matters during a heart attack or stroke. Quick treatment can save heart muscle, protect brain function, and improve the chances of recovery. Now let's shift from warning signs to something encouraging. While we can't stop the aging process, there are many evidence-based habits that support heart health at every age. And the good news is that these habits don't require expensive equipment or complicated routines. Let's start with movement. Regular physical activity remains one of the strongest lifestyle tools for supporting heart health. That doesn't mean everyone needs to run marathons. For many older adults, a brisk walk, swimming, cycling, light strength training, or chair exercises may be appropriate, depending on their health and mobility. The goal is consistency. Even small amounts of regular movement are generally better than remaining inactive. If you've been inactive for a long time or have existing medical conditions, it's wise to speak with your healthcare provider before starting a new exercise program. Another powerful habit is paying attention to what fills your plate. A heart-supportive eating pattern typically includes plenty of vegetables, fruits, whole grains, beans, nuts, and healthy sources of protein such as fish. Foods high in saturated fat, trans fat, added sugar, and excess sodium are generally recommended in smaller amounts. Rather than chasing the latest miracle food, focus on the overall pattern of eating. No single food protects the heart on its own. It's the combination of healthy choices repeated day after day that makes the biggest difference over time. Sleep is another piece that's often overlooked. Poor sleep doesn't just leave you feeling tired. Over time, consistently poor sleep has been linked with a higher risk of several health problems, including heart disease. If you're regularly waking up exhausted, snoring heavily, or stopping breathing during sleep as reported by a partner, it's worth discussing with your healthcare provider. Conditions such as sleep apnea can often be treated, and treatment may improve both quality of life and heart health. Managing blood pressure, cholesterol, and blood sugar is equally important. These numbers may not cause symptoms for years, which is why they're sometimes called silent risk factors. Regular checkups help identify changes early, giving you and your healthcare team an opportunity to make lifestyle adjustments or discuss treatment options if needed. If you've been prescribed medication for blood pressure, cholesterol, diabetes, or another heart-related condition, take it exactly as directed unless your healthcare provider advises otherwise. Some people stop taking medication because they begin to feel better, but in many cases they feel better because the medication is helping manage the condition. If side effects or concerns arise, don't stop treatment on your own. Instead, have an open conversation with your healthcare provider. There may be alternatives or adjustments that better suit your needs. It's also worth remembering that emotional health and heart health are connected. Long-term stress doesn't directly cause every heart problem, but chronic stress can influence blood pressure, sleep, eating habits, and physical activity. Finding healthy ways to manage stress, whether through walking, gardening, spending time with loved ones, hobbies, prayer or meditation, or simply taking time to relax, can benefit overall well-being. Finally, don't underestimate the value of regular preventive care. Many serious heart conditions begin silently. Routine medical visits, recommended screenings, and honest conversations about new symptoms can help identify problems before they become emergencies. Think of these appointments as routine maintenance. Most people service their car before it breaks down completely. Our hearts deserve the same attention. As we come to the end of today's discussion, remember the main message. Growing older does bring changes. You may not move quite as quickly as you once did. Recovery after physical activity may take a little longer. That is part of life. But persistent shortness of breath, unusual fatigue, chest pressure, dizziness, swelling in the legs, irregular heartbeats, or other new symptoms should never be dismissed. Simply because of age, your body has an incredible way of communicating when something isn't quite right. The challenge is learning to listen before those whispers become louder. Early recognition doesn't guarantee that every problem can be prevented, but it often creates more opportunities for timely evaluation, treatment when needed, and healthier years ahead. If today's video helped you better understand the early signs of heart trouble, we hope you'll remember one simple idea. Don't ignore changes. Notice them, write them down, talk about them. That one decision could make a meaningful difference. Before you go, we'd love to hear from you. How old are you, and which of today's warning signs surprised you the most? If you found a daily habit that's helped you take better care of your heart, consider sharing it in the comments. Your experience may encourage someone else who is just beginning their own healthy aging journey. Thank you for spending your time with us today. Take good care of yourself, stay curious about your health, and we'll see you in the next video.